Operations Manager Juan Melli took home his new son Christopher from this hospital today. The sale of HUMC to HUMC Holdco is critical to the life of our state's oldest hospital that serves not only Hoboken, but provides essential services for Hudson County residents as well. With the city's $52 million bond guarantee of the hospital, the successful sale is also crucial to the financial health of the city of Hoboken. Without the sale to the principal owners of Bayonne Medical Center, our hospital simply cannot survive, and our city's finances will be severely impacted. Unfortunately, the financial health of HUMC recently became so dire that it was forced to declare bankruptcy. Without the resources to pay its growing debt, the hospital simply could not even pay its past debt to keep the lights on. In order to protect the safety of patients and hopefully reach a final sales agreement, a decision was made by the management company, HHI, to declare bankruptcy. Since the bankruptcy was declared, there's been an enormous effort to ensure the successful sale through the bankruptcy process. The process has included the negotiation of a settlement agreement and amended asset purchase agreement that had to be approved by the buyer, the Hoboken Municipal Hospital Authority, and the Hoboken City Council. I do want to give special thanks to Councilwoman Marsh, who thankfully was able to call into that council meeting from Nicaragua despite a family medical emergency, and without her fifth vote, the settlement agreement would have failed. In order for the sale to be completed, the settlement and the financials of the sales transaction must be approved by all parties involved in the bankruptcy proceedings. In fact, right now, the Creditors Committee is having a call to debate the latest offer and decide whether or not to accept the new proposed terms of the sale. I am looking forward to that call from the courthouse any minute, and I will tell all of you, we are this close. I want to say we are this close to having this deal go through and saving this hospital. So I also want to say, just give you a little bit more background on what we've been through to get to this point. Again, figuring out a way to have enough funds to provide to the creditors so that they agree with the sale has been a major challenge over the last several weeks. At what felt like was the 11th hour negotiations at the federal courthouse, when it appeared that no agreement could be reached, that the sale was going to fall apart, I decided to ask the City Council to support a $5 million bond on an emergency basis. I did this so that both Hoboken University Medical Center and the financial health of our city could be saved. The state told me they could not put in any additional resources. I was stunned by the council's decision that they would rather be in a position, quite frankly, to blame me for the closure of the hospital than to rise above partisan politics to save our hospital and the finances of our city. I needed 6 votes to get that bond through, and I could not, the minority council could not find a way to rise above petty politics. Thankfully, when Governor Christie learned of the Hoboken City Council's actions, he felt compelled to stop partisan politics from taking away your jobs, from taking away 1,300 jobs in the state's oldest hospital. I thank him so much for helping to save Hoboken University Medical Center. The governor's actions have helped to ensure that nearly 2 years of tireless work by dedicated community volunteers on the Hoboken Municipal Hospital Authority will hopefully soon come to fruition. I thank all authority members from the bottom of my heart for taking on the monumental, unimaginable task of trying to save this hospital. Tony Tamorazzo, the chair, who's here with me, Steve Roski, the finance chair, Dr. Kozel, and Dr. Fahmy, who are here today, thank you for working together to try to perform a miracle. Hopefully today we will hear a final decision from the Creditors Committee and soon learn that they support the sale of Hoboken University Medical Center. Based on the fact that over, I am told, 93% of the employees have applied for jobs under the terms offered by the new buyer, it is clear that HUMC employees want to keep this hospital alive. You want to continue to serve this community for the way that you have served it for over 150 years, and I thank you so much for your service to this community. I hope that your union leadership will listen to you, has listened to you, and that they today will cast the yes votes that are needed to support the sale and preserve the jobs for their rank and file, all of you standing before me today. Last night, the creditors committee asked for a dollar amount beyond the additional $5 million that was offered by the governor. And we were able to increase the available amount. And we hope at the end of the day, they will do, the creditors committee will do what is right for themselves, their membership, and our community. So again, we're standing by. We are this close. I thank you all for your dedicated service. And we will be putting out as soon as we hear, you will hear. We will be putting out a notice, or if I get the call right now, I'll be announcing it. So with that, I will take questions from the press.
What's the new dollar amount, and how were you able to add that?
At this point, I can't disclose it. Since it is we're in the middle of negotiations. If you want to, I'm going to invite the chair to come forward and help me to answer your questions. So yeah, since it's in negotiations, that's not something that we can reveal at this time. We can discuss at this time. It's confidential negotiations.
Also, where the money's coming from?
It's, at this point, I will say that the state, neither the state nor the city is putting in any additional funds beyond the $5 million. Any additional?
Mayor, I'm sorry, who is the potential buyer if this goes through?
So I want to say to the employees that Tony and I will come around and answer your questions. I'm just going to take questions from the press right now, and then afterwards, if you want to stay, I will come around and be glad to answer your questions. Sorry.
I'm sorry, who is the potential buyer again?
It's the principal owners of Bayonne Medical Center.
And how confident are you this will go through?
I am optimistic that it will go through. I'm extremely hopeful that it will go through, but again, it is down to the wire, and we're hopeful that we have the votes on the creditors committee and that they will vote to support this.
And if it does go through, explain it, just decide to leave and explain what happens.
So if this does go through, if they vote yes today, then there will be a hearing on Tuesday. The consent order will be entered, and there will be a hearing on Tuesday, and then the projected closing is for October 7th. Yeah, no, closing of the sale. Closing of the sale. So he just asked, his question was, what happens if the creditors committee votes yes? So if the creditors committee votes yes, there will be a hearing on Tuesday in front of the judge. So to review the consent order, review the settlement agreement, review the sales agreement. And assuming that if, the judge, basically if the committee votes yes, it's very likely, we can't say definitely, but it's very likely that would be approved by the judge on Tuesday. And then there needs to be a 14-day period where any appeals can be made. And then they're trying to have the closing on October 7th. That is the target date at this point. I can't say that that's definitely the date, but that is the target date. So no, when I say closing, I meant the closing of the sale and saving of the hospital.
Mayor, other bidders are starting to go public. Do you still stand by that this deal is the only way to save the hospital?
Yes, I do. Do you want? I absolutely do.
The RFP process that was undertaken by the Hoboken Municipal Hospital Authority was very thorough. We looked very carefully at all of the proposals that were submitted, and we used a number of criteria, one of which was that you had to have the funding to be able to effect the transaction. And sure enough, we see how complicated it is to get to this final sale to preserve this lifeline hospital that we have. The other bidders that we looked at was the unanimous opinion of the Hoboken Municipal Hospital Authority that this deal with the primary owners of Bayonne was the deal that would get us to the finish line and meet all of the requirements that we set out in the RFP, which was to maintain this hospital and all of the services. And that this bid and this proposal and this buyer is the one that's going to bring that vision to life in Hoboken for us.
And I will say, it's taken, I mean, it's taken a very long time to go through all of the due diligence and to make this deal, you know, to bring this sale to where it is today. So I'm extremely hopeful that this is going to go through, because this truly is the way to save this hospital.
Sure, and you made it sound like, or you said that you're very close to a settlement. Have there been any major breakthroughs over the last couple of days? Anyone that wasn't on board that came on board, or anything you could speak to that matter?
Yes, there have been significant breakthroughs. I don't really, again, because it's confidential negotiations, I don't want to speak directly to that. But there have been breakthroughs, and again, we are extremely hopeful that, you know, that it will pass and it will find the support of the creditors committee.
So you're confident by Monday this is going to be done, if not today?
I'm hopeful that if we know today, I think that we can, if we hear a positive vote today, I think that the employees who are here, I want you to understand, if we hear a positive vote today, that means we are really well on our, we are 95% there to saving this hospital, and I'm quite confident that it's going to go through, that everything is going to go through.
How many yes votes do you need?
Oh, sorry, it's two, yeah, so we're gonna hear the results of the vote today, and then the hearing would be on Tuesday.
How many creditors are not yet on board? Just one?
Yeah, I can't, again, at this point I don't know. They're talking to each other right now and debating, so I can't say. We'll know, you know, possibly within the next half an hour. So we'll put out a release on that.
In terms of the governor's contribution, can you speak to how that occurred and when you were informed about that decision from the state?
I was informed when I was at the courthouse, and I had, you know, basically I think that the governor had been briefed on the city council's actions, and he made his own decision that he wasn't going to let quite frankly, the partisan politics, as he said in his release, I think it speaks for itself, he wasn't going to let the partisan politics stop, you know, stop the sale of the hospital and stop the, you know, prevent. He wanted to make sure to preserve jobs. He wanted to make sure to preserve this hospital. And I will say, I want to thank Tony Tamarazzo, the chair, who's been a part of so many trips down to Trenton. I mean, we have worked extremely hard to make sure that the state understands how important this hospital is. So I think that overall has helped as well for them to understand it's not, this hospital doesn't just serve Hoboken, it serves Hudson County, and it's really important that it remains here.
Mayor, do you regret any part of this process so far and how you've conducted yourself? I know the council, part of the reason that the minority did vote because they felt like the process was shrouded in secrecy. There have been people who critique certain parts. I mean, would you have changed the way you did anything?
Absolutely not. I've done everything that I possibly could to save this hospital, and I started from the day I got into office and the day we saw a transition report from the Christie administration that said we should shut down, that recommended to our governor that we should shut down Hoboken University Medical Center. So I've worked extremely hard to build the relationships that we need to communicate to the Christie administration that this hospital is extremely important. And I've advocated every step of the way, and we've put together a fair and open process, and we've been proactive. And because we have been proactive, we are here, we have a solution to the challenges and the financial challenges that this hospital has faced. So no, I feel very, very good about everything that has been done, and I am hopeful that we're gonna hear the final solution in just a few short minutes.
Do you feel like the trust between the hospital's employees and Hoboken citizens and the city council, members of the city council in general, has been tested by this whole process? I can't speak to that. I mean, everyone will have to make their own decisions. But it was sad to me to see the city council cast the vote that they cast. I mean, I was coming to them on an emergency basis saying, please help me to save this deal. Please help me to save the hospital, to protect our city's financial interests. And they chose to vote no. So that's, everyone will have to you know, figure out how they feel about that. But to me, it was extremely disturbing.
You say you feel pretty good right now as far as the sale, confident it's going to go through. What did you feel back then? When you know?
On that night? On Wednesday night?
No, when at the time when you know, you were talking to the governor that it might shut down, way back.
Well, there was I mean, that report came out in November 2009. I had just been elected, and I didn't know the governor at all. And so I was extremely concerned. I mean, I was on the phone with Joan Quigley and Spiro Soteris and trying to figure out how we were going to respond to the fact that they were saying they should shut down this hospital. So we worked hard to get corrections to it. And that was my, I knew that I needed to really look carefully at Hoboken University Medical Center. And the day that I got that report, I knew I needed to really work, make this a top priority. And I have, and I'm very proud of where we are today and extremely hopeful that this sale is going to go through. So I thank you all so much for being here. I want to say to the employees who are here, I recognize this is extremely difficult to be in a place where you don't quite know what's going to happen. That's why it was very important to me, even though we don't have a final decision, I wanted to come today and try to reassure you and try to have you know that I believe that we are very, very close to having this deal go through, that we are very close to saving this hospital. And we will be putting up a press release when we get the final news. You can look on HobokenNJ.org to get the information. Probably should be out there tonight. So you have a place to know and to find out what is going on. So I hope you have a wonderful weekend. And thank you again all for being here. Thank you.